Let's talk about heavy periods. It's not necessarily okay to have these really heavy periods. I'm Dr. Rahi Victory, a reproductive endocrinology and fertility specialist, and today we're going to talk to you about what's normal and what's not normal and what you can do about it. So in terms of the heaviness of your period, there's no really totally accepted definition, but we know that there is a certain volume which is considered average, and if you're soaking through a pad or a tampon more than every 3 to 4 hours during the heaviest parts of your period, you're probably going to end up having what's defined as a pretty heavy, awful period. And that can sometimes be okay, but it's not always necessarily normal, and it's certainly awkward and uncomfortable and can lead to social problems requiring you to either not to go out or having accidents when you are out. So we want to address this concern with you. So number one, why does it happen? Well, let's talk a little bit about the physiology. Inside your uterus, there are all sorts of blood vessels which supply it. And as they move through the muscle wall of the uterus, getting closer and closer to the inside, they get smaller and smaller and smaller. Once your body recognizes that you're not pregnant, it causes spasm of those blood vessels that are really tiny, which causes the lining of your uterus to not be supported anymore with the blood supply, and so it starts to shed. That's literally how your period begins. So no blood vessels, no blood support, all the tissue starts to die, and it literally just kind of washes out of you. Your uterus gets very crampy at that time from some of the hormones and proteins that are going on. And that cramping is directional, so if you put all the cells here, it's riding the wave right out your uterus, which is where the blood is coming from. So what causes those periods to be heavier? Well, if you have a really big uterus, that can cause it. If you have polyps or fibroids, that can cause it. If you have a hormonal abnormality like polycystic ovarian syndrome, where your periods are not regular and the lining keeps getting thicker and thicker, and then finally you have a period, that can definitely do it. Sometimes you might have a bleeding disorder where your blood doesn't thicken properly, so someone like a hemophiliac or someone that has von Willebrand syndrome, that can cause it as well. And then of course we always want to rule out the chance that you are pregnant, and that's what's causing your bleeding to be abnormal, not necessarily a period bleed, but that you're now having abnormal and heavy bleeding. You got to rule out that you're pregnant, because we got to make sure you don't have a pregnancy that's in the wrong location, or that God forbid you're miscarrying. Both of those can be sort of important and threatening circumstances and may need additional medical care. So how do we test to figure out what it is? Well, you can do hormone checks. You can do a check of your iron and your blood count, which is really easy. And we want to often do at least a baseline ultrasound or something called a saline infusion sonohystogram. You can see a link to our video right there. You flush in some fluid, we can recreate the inside of your uterus in 3D. If there's a polyp or a fibroid or even an abnormal shape to your uterus, we can figure it out from there. What do you do once you have the results? Well, obviously it's based on whatever is wrong. So let's talk about some basic options that can apply. If it's a structural problem like a polyp or a fibroid, well, you get them removed. So you can have minor surgery hysteroscopically, where we go in to the uterus with the camera, we can look around, take out the polyps, take out the fibroids, and you're done. Super easy, very simple to do, hassle-free, and generally very safe if done by an expert. If it's a hormonal problem, you got to address the hormone problem. So if your thyroid is either underactive or overactive, both of those scenarios can cause bleeding abnormalities. So treat the thyroid disease. If you have similarly a bleeding disorder like von Willebrand syndrome, sometimes you have to be on medication in order to treat the von Willebrands, and that will resolve the bleeding problem for you. Super easy to do. Any family doc can usually manage that. In the worst case scenario, you need to see either a gynecologist or a hematologist, but very simple, easy to manage things for us to take care of. And then the more important group is the group where we really don't find an answer. So there's nothing structurally wrong with you. There's nothing hormonally wrong with you. Why am I still having these heavy periods? Well, we don't always get to find out why, but there are treatments. So first and foremost, if you do something really simple like take ibuprofen, as long as there are no contraindications to doing so, at least one day before your period is coming, you can cut down the amount of blood loss tremendously, anywhere from 50 to 70% reduction in the volume of blood loss. So that's really easy to do as long as your periods are very regular. Start taking the ibuprofen ahead of time. Make sure you take it with precautions, full stomach, don't take too much, and that can really drastically reduce your chances of having a heavy period. Number two, you can go down the non-hormonal approach with something like tranexamic acid. Tranexamic acid stops part of your blood tissue remodeling and healing from breaking apart, which allows you to bleed more easily. So by doing so, by blocking that critical step, you actually let the blood stay thicker. When the blood stays thicker, you don't bleed as much. So again, great approach to things as long as you don't have any risk factors for forming blood clots. Totally safe, very usable. Number three, you can go the hormonal route. So the hormonal route is most often going to be taking some form of birth control, and that allows you to either reduce the significance of the period because you're getting enough progesterone so your lining doesn't get really thick, or to eliminate it completely by just taking the birth control pill continuously, and then you don't have to have a period at all. Now, some people are going to start screaming and saying that's not natural, that's not safe. It's been studied over and over and over again. There's absolutely zero risk to doing that, and there are many patients that need to or want to for a variety of different reasons. So that's completely reasonable to try to. Other hormonal approaches, you could take a Mirena or Kyleena IUD. These are IUDs that contain progesterone in them, and they leak into your uterus, reducing the thickness of the lining, and in many cases as high as 60%, eliminating your period entirely so that you don't have to get a period. There are side effects. Sometimes you end up getting some spotting. The spotting can go on for quite some time, but typically after 3 to 6 months, you get very few side effects. The spotting disappears. It's an excellent form of birth control, and it's really good for bleeding. In one particular study, 80% of women that had booked themselves for a hysterectomy but got a Mirena IUD actually canceled their hysterectomy because they were satisfied with just the IUD. So that's a very reasonable approach to things. There are some other things you can do as well hormonally. You can take Depo-Provera. It's a 3-month shot of progesterone. I can't say I'm a huge fan. It causes a lot of side effects: depression, acne, hair growth, weight gain, bone loss. So it's not ideal, but in some cases we have to use it if the bleeding is not responding to anything else. And then there are the kind of anti-hormone approaches, which are taking drugs that can suppress your pituitary function, which are either called GnRH agonists or antagonists. So things like Orilissa, which is the antagonist, or Lupron, which is the agonist. And that can completely stop your bleeding, but they do have a lot of side effects because chemically we're putting you into a temporary menopause. Your estrogen's gonna bottom out, and when that happens, you get all of the low estrogen symptoms: hot flashes, night sweats, mood swings, vaginal dryness, decreased sex drive, and sleep disturbance. And they can kind of come all at once, so it's not a really fun time for any patient. And we only would do that for a short period of time if we had to. You can take those drugs with some add-back therapy, which is just taking a low dose of estrogen and progesterone, or even just progesterone alone. You get none of the side effects and all of the benefits, which is a great option for some people where they're not responding to some of the other stuff. Finally, you have surgical options as well. If you're done with having children, or you're not worried about having children anymore, then your options are going to include things like either having an ablation where we can go in and burn the lining of the uterus, or you can have it done via a hysterectomy, and that can be done either open or laparoscopic or vaginal. Generally speaking, these days, very safe procedure, very minimal trauma, and especially if you're having it done laparoscopic or vaginal, you can be home the same day or the next day with a relatively rapid and safe and easy recovery. So if you're bleeding heavily, definitely talk to your doctor, advocate for yourself. Don't accept this is normal, because it necessarily isn't, and you can find out if there is something wrong and how you can address it. I hope you find this video useful. Make sure you comment below, let us know things you've tried, and if there's anything else you think we can add. Have a great day.